One of the most important things is to get patients up and get them mobilized to assess the wounds that we're going to be working with, all the upper and lower extremity injuries, make sure that none of the patients develop contractures and get them moving. Amputees, because we know there are thousands of amputees over there. They're starting to get them to do their own care, getting dressed or feeding themselves as much as possible. There are different splints that can be developed. This is a rudimentary one for someone, you can imagine, with a bilateral amputee, just to get them to feed themselves. And then different other splints that we'll just have to develop,
fabricate as we go
along.
I know our supplies will be limited, but we'll be able to work with whatever we have.
The patients moving that have had upper extremity injuries, crush injuries, so that they can start using their limbs, start using their arms, so they don't end up with contractures, and that then in the future they can have a functional limb that they can use to get dressed, to feed themselves. We're going to be going there to just try and assist wherever we can, perform wound care, range of motion, make splints from whatever it is that we find, from plaster,